What is a bunion? How do we fix bunions? When's it time to have your bunion fixed? I'm going to give you a surgeon's point of view on how we fix a bunion surgically. We're going to talk a little bit about what bunions are, and I'm going to go through all the possible treatment options for them in this video. If you have any questions about what we're doing here, or how bunions form, or what causes them, or what you can do to prevent one, drop it in the comments section below, and I will do my best to answer those questions. So what you're watching in this video is an example of how we perform a minimally invasive bunion surgery. So minimally invasive bunion surgery has now replaced traditional bunion surgery, which used to have a large incision over the joint. It would accompany with it long recovery times. The patients had to be non-weight bearing for sometimes 6 weeks. They used to miss tremendous amounts of work. It was a very grueling process to undergo traditional bunion surgery. And this new minimally invasive procedure that we're doing here has greatly changed the way we're able to fix them. We're able to make small incisions. We can get correction that was unimaginable when we would do these open, and the patients are getting back to work much faster. So that's what we're performing here, and we're using the Arthrex minimally invasive surgical bunionectomy set. And you can see what we did here. We made a cut through the bone on the head of the metatarsal, and we're using some instrumentation to shift that bone over. So this is probably a great time to explain what a bunion is. It's not just a bump that's growing on the side of the big toe like many people think it is. People come in and think, oh, I have a bump on the side of my big toe. Can't you just shave it away? Isn't it just a procedure where you can shave that bump away? And you can. You actually have to cut it. And you can see that's what we're doing here. We make a cut through the head of the metatarsal, and then we're going to push that head of the metatarsal over with instrumentation. That's what we're doing here. We're putting the toes straight, realigning the joint. And then we're going to hold the bone in place with 2 screws that temporarily fixate it while the bone heals itself. That's what we're doing here. We're inserting these wires to hold that head of the metatarsal over where we had repositioned it. So the traditional procedure used to require a large incision over the great toe joint, and we would still make these cuts like we're doing now, but the challenge was you're opening up the joint, so now the toe is becoming greatly unstable. You couldn't really control the positioning of the toe. You would only slide the head over a little bit, so you weren't able to get great correction, and a lot of these procedures tended to reoccur because we couldn't reduce the bunion enough. We couldn't reduce the joint, put it back into position like we're able to do when we don't open it. And when I say open it, I'm referring to the joint capsule itself. And when you open the joint capsule up, you're compromising the integrity or the structure of that joint, which can allow the head to kind of move over, and it can achieve a position known as a hallux varus, which means great toe and means moving away from the body, and it actually does the opposite of what a bunion would do. And that is less likely or almost impossible to occur when we don't open the joint, as in a minimally invasive procedure. So what can you do to prevent a bunion from occurring? Well, there's not much you can do. It's mainly a biomechanical deformity that can be genetically induced. And I would say a great majority of patients who have bunions inherited them from somewhere along the line in their family. So one could make the argument that bunions are due to shoe gear, and they can be, I would say, worsened by shoe gear. And sometimes shoe gear will cause the bunions to occur earlier in life, but it's not the sole cause of it. In fact, we'll see them in younger patients. My daughter actually had a bunion and still does, but we noticed it when she was around 6 to 8 years old, and it's gradually progressed over time. She's 16 now, and it's to the point where it could be fixed. So then, that brings up the question, I guess I'll interject here before we talk more about some conservative therapy, but when is it time to fix your bunion? When should you fix it? Well, I usually tell patients when it becomes painful, that's when you want to consider fixing it. And that doesn't have to be immediately. Once you've identified that the toe is starting to move over, it's starting to touch the second toe, it's starting to maybe overlap and become painful, now it's time to consider it. And then I would say you want to pick a point in the next calendar year that works best for you. That could be the summer, it could be the winter. Teachers, some of them like to do it in the summer. Some teachers like to do it in the winter because they wanted to get some time off of school. They don't want to lose their summer months that they have off. Everybody has the best time in their own schedule to do this. And what I usually tell patients are, whenever it's more convenient for you, whenever it works best, that's when you'll get the best results because you won't be frustrated. You can have your time to allow it to heal. And in regards to healing, I had mentioned earlier with traditional bunion surgery, patients were off their feet for 6 weeks. With minimally invasive bunion surgery, we let them walk on it from day one. They'll get a cam walker, which is a boot with some Velcro straps. You may have seen other people wearing these. With bunion surgery, we use the smaller one. It only goes about halfway up their leg, just past the ankle, and it holds the great toe into position and allows them to walk. And it has a rocker bottom to it and kind of disperses the pressure so that we're not disrupting the surgical site. And an analogy that I'll give to my patients is, if you have two boards that have been screwed together with wood screws, if you just drop it a few times on the floor, nothing is going to happen. Those boards will still remain solid. But if you wiggled them back and forth several times and pried on it and moved them quite a bit, multiple times, you probably would loosen it. And that's the same thing that can happen with your bunion that has been corrected. If you're walking a lot without that boot on that's protecting it, you could loosen that site that we fixed surgically. So let's back up a little bit and talk about what are some things you can do conservatively to treat your bunion. Well, the first thing that I tell patients to do is wear some wider shoes, because usually the pain from the bunion will occur on the side of the great toe where that bump has formed and it rubs on your shoes. So if you wear a wider shoe, it can reduce some of the pressure on the great toe. Another option is to put a toe spacer between the great toe and the second toe, because when the great toe dislocates, it puts pressure on the second toe, and that actual movement itself will kind of create more force on the bunion or on the metatarsal phalangeal joint, which is the big word for the great toe joint, and cause that head of the metatarsal to protrude even more. So if you have a toe spacer in, that's going to help keep that joint congruent or realigned. And a lot of patients will think, well, can I just wear this at night when I'm sleeping? Well, no, it's something that you want to wear while you're walking, because that allows you to function with the toe in a more rectus or a more straight anatomical position. The minute you take that toe spacer out, the toe is going to go back over. And that also applies to the night splints or bunion splints. I shouldn't call them night splints because that's something that's for plantar fasciitis, but a bunion splint is something you may have seen. You might have seen them on TikTok where people are putting them on and they're dialing it in and cranking the big toe over. And that's fine. It'll hold the toe over while the device is in place. But the minute you remove that device, the toe is going to go back to where it was. So those splints won't do much. I'm going to get away from the conservative therapy and talk to you about what you're seeing here. These are the stitches that go in for the minimally invasive procedure. And as you can see here, there's only 3 tiny incisions. Imagine that. We used to make one long incision, and some surgeons are still doing this. They're making several long incisions. There's a procedure known as a Lapidus procedure, and some surgeons will use 3 large incisions. They'll use one over the joint in the midfoot. They'll use one over the side of the big toe bump where you're seeing the actual bunion, and then they make another one on the space between the great toe and second toe. So look, we're able to achieve correction with just 3 tiny incisions here. So it's remarkable. So what about some other conservative options? Well, we kind of touched on the wider shoes, the toe spacers, the bunion splints. You can also do some physical therapy to strengthen the foot, and there are some studies out there and some theories that if you make the muscles stronger in the foot, it can pull the big toe over. But that would mainly hold true for some of the milder deformities and if you can catch it early on. But if you have that genetic predisposition to have a severe bunion deformity, it's unlikely that strengthening the muscles are going to help you or reduce that deformity. So after this procedure, the foot gets bandaged up, and you can see that's what we're doing here. We put those sutures into those small incisions, and we're now going to put a soft bandage dressing on this foot, and that's going to stay in place for about anywhere from 3 to 5 days, and then the patient will follow up in the office afterwards, and we'll change that bandage. And usually I tell my patients within 7 to 10 days, they're able to start getting their foot wet. They're going to have to keep it dry when this bandage is on. After 7 to 10 days, we'll change the bandage. And then depending on how the incision sites are healing, if they're healing faster, I'll tell the patient, I don't need to see you for about 3 weeks. You can change this dressing that we put on today in about 5 to 7 days and start showering and getting it wet. And these stitches that we put in are absorbable. But absorbable stitches will only dissolve internally. And some of these, you can see, obviously, it's on the outside of the skin. So what will happen is that'll gradually break down over time, and they'll just pull on it, and that stitch will come right out. So that's another nice benefit of this technique that I perform, is that patients don't have to have their stitches taken out. And then at around 4 to 6 weeks is when I tell patients they can start walking a dog. They'll actually come out of the boot at 3 weeks. So the first 3 weeks they're in a boot. 3 weeks they come out of the boot and go into a running shoe. I usually recommend an oversized cushion running shoe, like the Hoka running shoe that you may have seen people wearing. And then at 4 to 6 weeks, I can progress them to walking a dog. At 6 to 8 weeks, I'll allow them to start doing more aggressive activities, like even running at that point. And then we take x-rays generally around 4 to 6 weeks after surgery. We'll do another x-ray around 2 months after that, and then usually about 4 to 6 months after surgery, just to confirm that everything has healed adequately. So I hope you enjoyed this point of view video for how we do minimally invasive bunion surgery. If you have any questions, drop them in the comments section below. I'd love to try to answer them. I do my best to answer a lot of these questions. We're almost to 500,000 subscribers, so it's difficult to answer all of them, but I do look for some of those and try to answer them. So thanks again, and I look forward to putting out more videos for you guys.